Which is the earliest sign of pregnancy visible on ultrasound? Correct option is C. Which type of pelvis is most favorable for vaginal delivery? Correct option is B. Which hormone maintains the endometrium during the luteal phase? Correct option is D. The most common cause of first trimester abortion is. Correct option is B. What is the normal duration of the puerperium period? Correct option is D. Which fetal presentation is associated with prolonged labor? Correct option is B. The length of a normal umbilical cord is approximately. Correct option is C. Which of the following is a common symptom of polycystic ovarian syndrome? Correct option is C. The most common type of uterine fibroid is. Correct option is C. Which infection is associated with congenital abnormalities when acquired during pregnancy? Correct option is C. Which is the best time for amniocentesis? Correct option is C. What does a reactive non-stress test indicate? Correct option is B. What is the most appropriate contraceptive for lactating mothers? Correct option is C. At what station is the fetal head engaged in the pelvis? Correct option is B. Which is a symptom of menopause? Correct option is B. The Apgar score is assessed at. Correct option is B. Which drug is commonly used for induction of labor? Correct option is B. Which part of the fallopian tube is widest? Correct option is D. Which condition is characterized by a string of pearls appearance on ultrasound? Correct option is C. What is the primary treatment for uterine atony after delivery? Correct option is C. A uterus larger than expected for gestational age suggests. Correct option is A. Which of the following is used for clavicle repinning? Correct option is B. Which is the most common site for an ectopic pregnancy? Correct option is B. Which hormone peak just before ovulation? Correct option is B. Which is the best indicator of fetal maturity? Correct option is D. Which type of episiotomy is most commonly used? Correct option is D. Which fetal presentation is associated with cord prolapse? Correct option is D. Which is the most accurate method for gestational age estimation in the first trimester? Correct option is C. Which hormone stimulates breast milk production? Correct option is C. Which maneuver is used for shoulder dystocia? Correct option is B. Postpartum blues usually resolve within. Correct option is C. Which of the following is an absolute contraindication for combined oral contraceptive? Correct option is B. What is the most common cause of infertility in women? Correct option is C. Which medication is given for prevention of neural tube defect? Correct option is D. The classic trait of ectopic pregnancy include all except. Correct option is C. Which type of logia appears red and lasts for the first few days postpartum? Correct option is B. When does the fetal heartbeat become detectable by Doppler? Correct option is C. In which trimester does gestational diabetes most commonly present? Correct option is B. Which investigation is best for evaluating uterine fibroid? Correct option is B. Which of the following is not part of the Bishop score? Correct option is C.